I just 622. Good morning, Claire. How are you?
I'm the neurosurgery service manager, so that's anything to do with the spine and the brain.
Claire is the master of spine surgery. She knows every surgeon and what they like, what they need. She's always looking ahead 2 weeks to make sure that everything's ordered and taken care of so that the day we do the surgery, there's no missing parts.
Sometimes we have 2 and 3 rooms going at the same time. This is going to be an anterior cervical, so this patient's having a problem with a herniated disc in her neck.
We work really as a team.
Immediately prior to incision being made, we do what's called a timeout. We review the patient's name, date of birth, exactly what we're doing for the procedure, what equipment we have in the room, the patient's films, and just make sure that we have everything we need for the case.
Our job would be very difficult without nurses like Claire. That's what makes other surgeons like to operate here, especially surgeons that operate at 4 or 5 other hospitals.
But we make a difference to a lot of people's lives with the surgeries we do.
My name is Justine Rice. I am a flow coordinator in the emergency department. I've been working at Northern Westchester for 24 years, and 13 of them have been in the emergency department.
Hi, it's Justine.
From the time that I arrive at 7 a.m., I coordinate who goes where, kind of like the air traffic controller.
Well, Dr. Marcus?
There's a variety of patients that you can receive from a pregnant mother about to deliver a premature baby. Anything from a sports injury to an ICU type of admit.
My mother was brought here today as a patient after having fallen at home. She actually had a hip fracture that was repaired here about a month ago, so I decided to bring her back here since she had such great care. I'm a nurse myself, and I know that when you are hospitalized that nurses are the ones on the front line, and I'd rather her be in a place where I knew she was having great nursing care.
The Gluck is 34. My name is Dorothy Caffrin. I've worked here for 2.5 years on the medical oncology unit. I have a specialty in hospice and palliative care. That's my personal passion and love.
Hello, Mrs. Wall. How are you, my darling?
Being at the bedside, you can make a difference regardless of what stage that a patient is at on the spectrum of their oncological disease. Even towards the end of life care, that is particularly rewarding for me because even when people think there's nothing more we can do, there's still a lot that we can do. I did have one particular patient a few years ago. It was time to stop all treatments, and she was at peace with that decision. As soon as the husband saw me, he gave me this huge tear-filled hug, and I felt like I was there with her in particular from beginning to end, and she will always be a part of my heart.
My mum always wanted me to be a nurse, and I kept saying, no, I don't want to do that. And then I left school at 16, and I went to work in a computer department, and I was completely and utterly bored. And I said, you know what, I think my mum was right.
When I first started working here, I never thought I would be at the level I'm at now. Even when I first started working here as a student nurse, I used to be like, I can't wait to be like that one day.
I know that I'm making a difference. I know it in the patient's eyes. I know it when I'm driving home, even if I had a 14-hour day instead of a 12-and-a-half-hour day. And that's very, very satisfying, and that's what keeps me coming back.